pandemic.
Mm-hmm.
And this was our test.
Okay. And I've started recording and I'm about to set up um the live feed.
So I've got a cup
So
of coffee. Are we going to be just audio or video and audio?
audio both.
Okay, I'll put my cup of coffee down.
Oh, you can like this is relaxed. Um
Now, you know, when you're hitting your third cup, it's probably enough.
and I haven't had one, but I
Do you drink coffee?
definitely could use. But I've switched over to more tea just
Hmm.
because of my age and my body said, um, you need tea. So I drink a lot of well, I say a lot, probably yeah, more than I should. Herbal tea, but it's not just the best blend, but
But decaf.
it it gets the job done.
Yeah.
No, not decaf.
Oh, not decaf.
But
Herbal
I think
tea
it's
plus
low.
caffeine. Okay.
I still need a little something, but
Yeah.
I'll drink like peppermint or my sister bought me this multi flavor pack, and so I'm kind of going back and forth between peppermint and the English breakfast. I don't know. Those are kind of my two go tos right now.
Yeah. The English breakfast has a nice amount of caffeine in it.
Maybe that's what I like.
Yeah.
Excuse me. And if I cough, please ignore me and just keep it rolling. This seasonal stuff is just getting on my nerves. What are the letters? Let me spell your name of Braham. Okay. And what
ABRAH.
are the letters after that?
Um,
ABRA.
yeah. So there's a junior at the end, and so
Okay.
a comma JR period, and then MD
Okay.
and MACP.
I'm sorry.
MACP.
MAC.
P
Off
is in
that.
Peter. Yeah.
Okay.
Yeah. And then I'm an assistant professor of clinical medicine at
Okay.
NYIT Com.
I'm just trying to put enough description. Um,
Oh, I'm an infectious disease specialist also. So
but we'll bring that up in
okay.
because I got a few moments. I don't want to miss our time. Um, Unfortunately, like I'm having to switch back and forth between two screens, and I can't see the other screen that has the timer on it. Um, which we're probably hitting right at the oh. Yeah, just I figured we're a minute late. Good morning, everyone. Welcome to your tune in to Community Conversations on KLK 102.5 FM. I'm your host, Lavila Jones, and my special guest today is Dr. Carl Abraham of NYIT. And I know he's an assistant professor. And please give me your other titles. I apologize, sir.
Oh, sure. I'm an MD and an infectious diseases specialist. I'm also an assistant professor of clinical medicine at NYIT College of Osteopathic Medicine here at the Jonesboro campus.
All right. And I thank you so much for joining us today. I know that we were hearing so much in the news about COVID-19, different strands, now the vaccine, and different people have been sharing their experiences with getting the vaccine, some one dose, some the second dose. And so let's just, start from, well, I don't want to go all the way back to the beginning, but let's just give people a recap of what COVID-19 is. And also let people know the COVID itself virus is nothing new, but the 19, what's significantly different about that strand?
Sure. So, first, thank you so much for having me on. It's really a pleasure to be here and be talking to you and your audience. And let's see how many things we can sort of clear up. Uh, so, COVID-19 is an illness, and the virus that causes that illness is called SARS-CoV-2. How many things we can The virus is a small piece of genetic material surrounded by what's called a capsid. So, sort of this case that surrounds the genetic material, which is RNA, and that case has a bunch of spikes on it. And it's that spike that's a protein that attaches to receptors on our cells,
Oh,
allowing the
okay.
virus to enter our cells and cause infection. And
Okay.
because those spikes project outward from that case, it sort of looks like a crown. And that's what corona means.
Okay.
Corona is Latin for crown. So this is a virus that sort of looks like a crown. About 30% of the common cold is caused by related coronaviruses. And there are about 7 strains of coronaviruses that infect humans. There are hundreds of other coronavirus strains that infect other mammals and animals. And these viruses, part of that genetic information, codes for the proteins and enzymes to make more virus.
Okay.
Viruses are different from bacteria and human cells in that they can't live by themselves. They can't replicate by themselves. They need us. They need other species in order to replicate in their cells. So viruses use machinery of replication that we have in our own cells to replicate. So
Yeah.
there's that genetic material inside. There is a protein, and we'll talk a little bit about this later. There is a protein or enzyme that they do make that replicates their own genetic material, and that replication mechanism is prone to error.
Okay.
And that's why one of the reasons we're seeing these mutations or variants.
Wow. Yes, I know that quite a few people are up in alarm because now we're hearing about, as you said, mutations. One moment the story was it was over in another country, and then all of a sudden it was here in the United States, and they're like, "How did it get here?" Because we're not traveling. Well, we're not supposed to be traveling, so it's like so many questions that are going on in everyone's mind, and I know things like that can cause a high state of alarm. But I'm glad you're here to kind of help break down, so we can have a better understanding of what we're dealing with and how to navigate going forward. And I know this question is going to get asked, and we'll get into this when we get to vaccines.
Sure.
Okay, so if from what I've learned from basic biology and chemistry, science, that bacteria can be killed, but viruses cannot be killed. And so I'm sure some people are questioning, well, if I take the vaccine, it's a virus, how is it ever going to die? Is it ever going to die? How about, all those questions? But we can get to that when we get to, I don't want to jump too far ahead because
Sure.
I want people to have some understanding of what we're dealing with and how some of the hows it got into humans and how it mutated and things of that nature. So I kind of feel like I don't know where to start because there's so
So,
much information.
yeah. So first, just to make sure we answer that question, viruses can definitely be killed. There's
Oh,
nothing special about viruses. I've heard that same question about staph, and all of these things can certainly be killed. A little bit of bleach is a really good way to kill bacteria and viruses, and just as long as you don't drink it. The So where did this come from? Because the genetic material in this virus that codes for that protein or enzyme that allows it to replicate its genetic material is prone, because that enzyme is prone to error, you don't necessarily get the same um, sort of virus every time it's replicated. You get these sort of little variants, and most of the time, those mutations in the genetic material cause the virus to not function as well.
okay.
So the vast majority of those mutations result in viruses that can't compete with what we call a wild type virus, the virus that has its regular non-mutated genetic material. Uh, so those viruses that have the mutants sort of die off. They don't propagate well. They don't maybe transmit to other humans as well. So we call them less fit. Every once in a while, you get a mutation that results in the virus being more fit in some way.
Okay.
And those viruses that are more fit do outcompete the wild type virus to become predominant strains. And
Wow.
that's what's happening right now. And we talked about this before the show, but this is not unexpected. And at the beginning of the pandemic, there was certainly the worry that this virus was going to mutate in such a way to become more contagious, or what we call more transmissible. And one of the great fears right now is that the virus mutates to become not only more transmissible, but also more powerful, causing
Mm,
worse illness. And there are studies right now trying to investigate whether that's actually happened. The multi-system inflammatory syndrome in children. We don't know whether that's being caused by a variant, and why the virus causes such severe disease in some people and not in others. We don't know if that might be caused by specific genetic variants. Um, one of the questions I frequently get is, why can't we get ahead of the virus?
well,
And the reason is, uh, it would it's almost impossible. Right now, the UK is analyzing the genetic sequence of about 10% of all of the infections that are currently occurring there. So they're not analyzing 90%. And I will let you know that 10% is a huge amount of work. So trying to keep up with the virus is virtually impossible. We're always going to sort of be behind the eight ball until we get a universal vaccine that works no matter what. Um, no matter what mutation occurs, we've heard talk about escape mutants. In other words, can a virus mutate so that the vaccines don't work anymore? The vaccines work by producing an immune response to those spikes, the spikes of the crown that protrude out of that case. So, and the antibodies that we make from the vaccine recognize a specific small part of that spike. So what
okay.
happens if you have a mutant that changes what that spike looks like so that antibody can no longer bind to the spike to stop the spike from binding to our cell receptors. Well, that virus can now be an escape mutant that that is no longer affected by the vaccine. We so far that really hasn't happened. There's some talk about, or there was a report over the weekend, I think, of one of the vaccines, the one by AstraZeneca that is in the UK, may be affected by some variants so that that vaccine is not as effective as some of the other vaccines. But the two vaccines that we have for use in the United States, the Pfizer, BioNTech, and the Moderna vaccines, both of them cover the mutants very well so far.
Okay.
The Johnson and Johnson vaccine, which probably will be authorized for emergency use very soon, also covers the mutants very well. The remarkable thing about the vaccines that we have out now is that they are much more effective than we usually see for vaccines.
Okay.
So when you hear that the Moderna and Pfizer vaccines are 95 or 94% effective, and then you hear that maybe the Johnson vaccine is 60 to 70% effective, don't say to yourself, oh my gosh, I want the Moderna, I want the Pfizer vaccine because they're so much better. Even 60 to 70% effectiveness from a vaccine is fantastic. We're lucky to get 50% effectiveness from the yearly flu vaccine.
Okay.
So these vaccines that are being developed are remarkably effective. One of the great stories, if we can think about the positives that have come out of the pandemic, is the change in how quickly the medical industry can now respond
Okay.
and how quickly the research community can work, how quickly information about that research can be disseminated to others in a free manner for everyone to read and comment on, and how social media and the cloud has been used. You know, the cloud provides so much more computing power than was previously available. How those things have been used by the companies that are doing research to really make this process so much faster without sacrificing the safety or the usual things that used to take years to do. You know, used to take a decade to get a vaccine out the door or a new
Okay.
drug out the door. Uh, they had this virus sequenced, the whole entire genome of this virus sequenced in a month after the outbreak was first reported in December. That is remarkable. So
Okay.
one of the myths that I commonly hear about the vaccine is, was this rushed? How safe is it? These vaccines went through the exact same types of trials that all other vaccines have gone through. But Pfizer and Moderna were able to use social media and the cloud to get people recruited into these studies and get these studies done so much faster
Okay.
than what was usual. And one of the things that really is sort of a logjam, that things that make studies so difficult to get complete, is enrolling patients or subjects.
Okay.
The cloud and social media made that so much easier, and they did it so much faster that they enrolled 40,000 subjects in months. So if you know, if you can think about some of the positive things that have come out of this pandemic, that is certainly one of them.
Okay, wow. Oh, that's a lot of information to decipher. And I know people are still, questioning, are the vaccines really safe? We do have a question in the comment section. I want to
Sure.
say good morning to David Smock. He says Dr. Abraham is the best. Good morning to Linda Johnson Frazier, Megan Mitchell Brown, and Miss Cora Martin asks, how do these viruses live in the air? I know we haven't touched on. Okay, so everyone's been ordered to, well, in essence, ordered to wear your mask, be mindful of who you touch, services, being outside, this, that, and enclosed spaces. And there's so many directions and so many suggestions on what to do and not to do. And okay, so let's talk about the virus itself and how it spreads and what information is out now versus when it first came out.
Yeah, that is a fantastic question. I'm really glad we brought that up. And first, I'd like to say hello to David. And David, please tell your mom I said hello, and I'm so glad you're listening to KLEK.
And one quick note, we
Yeah,
have
sure.
about 2.5 minutes left on air for this segment. But we will continue on Facebook. So when you see me throw my hand up, that means we're going to be off air. So, but
Yeah,
go
great.
ahead, Doctor.
So I have a lot of thoughts on my own about this, but I think the uh, the concept is we don't know a lot about this virus, despite how much we do know.
Okay.
So to expect things to remain the same, or the messaging on this virus should be expect things to change. Expect
Okay.
recommendations to change as we learn more about the virus. Expect recommendations that were made early in the pandemic to no longer be relevant because we know more about the virus now.
Okay.
So one of the things that was mentioned early on was this virus is really transmitted only by cough. In other words, a droplet transmission,
Okay.
droplets big enough to be affected by gravity so that when you cough, those droplets fall to the floor within 3 to 6 or 12 feet, uh, however long. So the recommendation was made for social distancing to be 6 feet because most of those droplets would not get to you if somebody coughed if you were 6 feet away.
Okay.
Well, some of the information before the pandemic regarding influenza and the previous SARS virus, which caused the pandemic in the early 2000s, and MERS, both of those are also coronaviruses, suggested that there may be other ways to spread coronaviruses. But we know that most coronaviruses are spread by droplet. Well, as more research was done, we found out that the SARS-CoV-2, the virus that causes COVID-19, can actually live on surfaces.
Okay. I'm
Okay.
going to pause right
Yeah,
there.
sure.
For those of you listening on air, I apologize. We're going to take a quick break. We will continue on Facebook. So jump on Facebook and join the rest of the conversation.
Cliffhanger.
Okay. So go ahead. Go ahead. Continue, Doctor.
Okay, great. So as we learned more and more studies were done, it turned out that the virus lived on surfaces, and depending on the surface, for longer than the first studies showed. So it became important to make sure that you disinfected surfaces around
Okay.
you. There was a very interesting report early on in the pandemic of a choir, and I think this was on the West Coast, uh, none of whom had symptoms. And eventually, the majority of those in the choir became infected. And this was already after people were saying you need to social distance. And so, and I'm not really sure how this choir socially distanced, but that sounded a little bit like aerosol transmission. Now, what's the difference between droplet and aerosol transmission? We said droplets are affected by gravity. So you get that 3 to 6 to 12 feet. Aerosols are not affected by gravity. And if you think about the opposite of being affected by gravity, they stay in the air for very long periods of time.
Mhm.
They can be they can be caught up in air currents like the wind or air conditioning systems. And they
Mm.
can be spread that way. And the classic aerosol transmission is measles. So the measles is another virus unrelated to the coronavirus, but it is extremely contagious and it can stay in the air in an aerosol for hours. And there are reports of someone with measles being in a room and that person leaves the room and hours later somebody else comes into the room and is infected with the measles that is still in the air. That's how infectious measles is.
Oh my
So
gosh.
it turns out that coronavirus can be transmitted that way. It is not as infectious as measles and it doesn't stay in the air for as long as measles does, but you don't want to be in a close quartered, small, enclosed area without a lot of ventilation with somebody else with coronavirus. And um, one of the very interesting things early in the pandemic is that the most common place to get infected was in your home. So,
I'm sorry, I'm gonna put a pause right
yeah,
there,
sure.
right quick. Okay. Welcome back to Community on Kelly K 102.5 FM. I'm your host, Quila Jones, with Dr. Carl Abraham of NYIT. Um, Carl Abraham Jr., I apologize, of NYIT, and we're discussing the coronavirus, well, COVID-19, and how it's transmitted possibly, and the vaccine, and everything in between that we can cover in this hour. If you missed our on off air discussion, he was discussing how um, the virus is possibly transmitted because we had a question about how does it live in the air. And so now there are studies showing, you said, please repeat that last little bit. So I don't want to mess it up.
Yeah, sure. So it turns out that as we learned more about SARS-CoV-2, the virus that causes COVID-19, you can get it through the air. It can be transmitted through aerosol transmission. It is still not the most common way that it's transmitted. And we were talking about one of the most common places to be infected earlier in the pandemic, before there were super spreader events, or before there were a lot of super spreader events, was in the home. So you were actually most likely to be infected in your own household by somebody else who had COVID. And that sort of sounds like not only droplet transmission, but aerosol transmission too. We know that about 40 to 50% of people who have infection with SARS-CoV-2 don't have any symptoms at all. They feel absolutely fine. So they don't know that they have it unless they're tested. And uh, they can be spreading that virus unknowingly to others.
Wow.
So you can imagine how many people were at home spreading the virus to their household.
And then,
And it wasn't uncommon for it to run, just like the cold. 30% of colds are caused by related coronaviruses. So that
mhm.
just like the cold can spread through households, and different people have sort of different symptoms. Uh, coronavirus or COVID-19 can spread through households just like the cold can.
Okay. I have a question. 'Cause this was brought up some time ago in the news, and I've heard this from other people about people that have a certain blood type.
Hmm.
I know there's a lot of myths, a lot of stuff out there. So let's just talk about this a little bit. People who have certain blood types are possibly, I don't want to say immune, but they're less likely. They have maybe a natural immunity to certain things, and COVID is one. So again, I've heard this. I just want you to throw it out there. What studies or have enough studies been done on that?
There are several studies to suggest that those with blood group O are less at risk for having severe disease from
Okay.
COVID-19, and those with blood group A um, are at risk of having more severe disease with COVID-19. That in no way suggests that you're absolutely protected from having severe disease, depending on your blood group. There's a lot of other things we don't know about the virus and why it causes severe disease in others. Uh, Certainly, one of the biggest myths about COVID-19 is if you're young, you won't get sick. And that's absolutely incorrect. I know in our area and throughout the country, there are people in their 20s and 30s and who are totally healthy, who have gone to the hospital and had a really bad outcome from
Hmm.
COVID.
I know a
So
young lady that's under 18 and she had it and she was down in the bed for a little bit.
yeah, well, I'm talking intensive care unit and possible
Oh, oh.
fatalities in people who had what seemed to be very low risk from having this. And it's really a numbers game. If you're over 65, you're at very high risk of having a poor outcome. And when I say poor outcome, it means being in the intensive care unit, possibly on a ventilator, and possibly dying. Uh,
Mm,
uh, Go ahead.
can I interject real quick?
Yeah,
So what let's take into account, I know this is maybe a whole other discussion.
sure.
Let's take into account some other factors. There are some people in their 60s and 70s that are physically healthier due to diet and exercise than maybe someone in their 30s, depending on, again, diet and exercise. So, taking those factors into account, does that increase someone that's elderly? Does it increase their chance of survival or fighting the virus versus someone who is unhealthy? We've heard this before as well. So
Yeah. So that's a great question, and that's a really great way to sort of introduce the concept of reserve. Reserve is how much more you have when somebody takes away something. So if I'm a farmer and I've got a grain silo and I've got that silo completely filled up, I can give half of that away and still have 50%, and that's my reserve. Uh, so if you are over 65 and you are physically fit, you are likely going to do a lot better if you get COVID-19 than if you're over 65 and have other risk factors for severe disease. We know that people who have diabetes, kidney disease, lung disease, cancer, and people who are obese as are at very high risk of having severe disease if they get it. So if you're over 65 and have many of those things, you could very well be in trouble if you get COVID-19. Under 65, the risk of having severe disease and dying from it is less than it is at over 65. But if you've got those same risk factors, even if you're less than 65, your risk of having severe disease, landing in the intensive care unit, or possibly dying is higher than if you don't have those risk factors, no matter what age you are. And again, I want to emphasize it's not as though you have absolute protection. And again, we are seeing people in their 20s and 30s who end up in the intensive care unit, and some of them are passing away from this illness without risk factors. So it's a numbers game.
Okay. We
If
have
you,
another question. So
yeah,
go ahead.
sure.
We have a
Oh,
question in the comment section. Ms. Linda asks, is it true that if you have had the virus, are you now immune to getting it again?
so that's a great question. And the answer to that question is we are not entirely sure that you will be immune to, suppose you get the infection early on in the pandemic. Say you got it back in February or March of last year, and you were infected with that wild type without any of the mutations. Um, and now there's a new strain, the new mutant strain that's going through your area. There have been reports of cases of people who were infected very early in the pandemic in China who traveled several months later to Spain. This is one particular case, and there was a different strain of
Mm,
COVID-19 circulating in Spain at that time, and this person got infected again.
well,
So it is possible to be infected again with COVID-19 if it's a new strain. I've heard, depending on the study, different timelines in terms of being immune from the strain that you were infected with, somewhere between 3 and 6 months, or maybe a year, maybe longer. So we don't really know yet how long you'll be infected. We don't know whether or not the vaccines will eventually become something like the flu vaccine that you get every year to make sure that we're covering different strains. So we'll see. That's a work in progress, but great
wow.
question.
Okay, and I had another question as you were talking about those in the hospitals and those that are unfortunately in ICU and that pass away from this virus. There's been a lot of talk about, okay, the most of the deaths have been marked due to COVID. And so some people are questioning, well, was their death, did they have any other conditions? And you mentioned that. So I don't know doctors are overwhelmed, nurses, are overwhelmed. But people who are doing autopsies, should they possibly or could they possibly look at the other factors and say, okay, they died from, say, heart disease, lung disease, whatever, but COVID accelerated it? Like, how will you label that death?
Yeah, so that's a great question. This brings up the concept of how accurate are the numbers that we see. When
Mhm.
we see on the Johns Hopkins website the millions of people who have been infected in the United States and around the world, and the hundreds of thousands of people who have passed away in the United States from this illness, how accurate are those numbers? And uh, those numbers are limited by the same type of accuracy for every illness.
Okay.
We report causes of death based on death certificates and
Okay.
other types of information, which all have limitations. So rather than focusing on whether or not those numbers are accurate, I'd suggest focusing on hospital capacity.
Okay.
We know that we're experiencing a surge, that the numbers are going up. Whether we know the complete accuracy to 100% of those numbers is irrelevant. We know that more people are being infected when hospital beds are filling up. Hospital beds don't fill up because we're doing more or less testing. They don't fill up because um, for any other reason than more people are getting sick.
Okay.
And more people get sick when there's more transmission.
Okay. Let's talk about again, I guess going back to transmission just a bit, and
Sure.
because again, we know that the new administration has passed, and I don't know, I don't want to call it an ordinance requirement that, now entering into any federal building, you have to wear a mask. And there has been a lot of talk about the states having the right to determine, what restrictions they will put in place for their state versus the federal government trying to tell each governor what to do when it comes to masks and distancing and gatherings and whatever. Okay, do masks work? What is their level of effectiveness? And does the type of mask, like I have some masks, they're not in my reach, but I have one that is kind of the hospital one, the accordion style one. Then I
Mhm.
have some others that are t-shirting material, but they have a filter inside.
Yeah.
Kind of we have about 6 minutes, so give us a short rundown of all of that.
Yeah, sure. So first, masks work. There's no
Okay.
question anymore. It's really funny that you sort of brought up like states can do whatever they want, and that's the way it should be. There are studies that have shown that on a county level, states that have allowed their counties to decide, those are sort of the natural experiments about whether or not masks work. And I believe it was Kansas. They looked at all of the counties and compared those that had good mask compliance versus those that had bad mask compliance. Shouldn't say bad. I saw poor, less mask compliance. That those counties that had really good mask compliance, people were wearing their masks, had much less transmission of the
Okay.
virus. Again, saving their hospitals from admissions.
Okay.
Right? And there are lots of other studies. And I think some of the confusion around masks came from the early messaging in the pandemic where the CDC said, we're not sure, we're not going to recommend masks right now. And as we learned about the virus, and as we had these natural experiments like the one in Kansas and more experiments, again, the research on masks has also gone into like rapid speed. So this area of study has evolved tremendously during the pandemic. There is no question anymore. Masks make a difference. So let's talk very quickly about the types of masks.
Okay.
First, there's a cloth mask, and the cloth masks are those that you can buy in the store or are you can make at home. They should have at least 2 layers, and the best have a filter in between those two layers, like you described. Um, Next, you have medical or surgical masks. Those are the masks that you see, the blue type of masks that you see that you can
Hmm.
either put behind your ears with straps or you tie behind your head. The ones that you see surgeons wear when they're in the operating room, those have a filter
It
on.
is more like this. This has Christmas theme on it, but
Okay, so
it's
the
the
other
same
side will show the
concept.
blue. Yeah,
It's white,
okay. So those types
but
of masks are very good at stopping transmission of coronavirus. And the best mask at stopping transmission is called an N95. The reason there are differences are because the filter, all filters have holes, and the size of the holes are biggest in the cloth mask and smallest in the N95. And in the medical surgical mask, they're sort of in the middle. Very early in the pandemic, sort of the messaging was also confusing because we didn't have enough of any of these masks. And we knew that the more people who went to the hospital, the more hospital workers were going to get sick. Doctors, nurses, technologists, transporters, nutritionists, everybody in the hospital is going to get sick. And what's going to happen to people in the hospital when people can't take care of you because they're all at home sick with COVID? More
Mhm.
people are going to die because you can't take care of it, the people in the hospital when half of the hospital is out sick. So that is a disaster scenario. You never want to tax your hospital so much that you can't take care of everybody who's there. And that's exactly what happened in Italy. I don't know if people remember back early in the pandemic in March, when Italy was really hard hit with COVID, their hospitals became overwhelmed. They didn't have enough ventilators. They didn't have enough beds. People were dying in the hallways. At that time, the death rate from COVID was somewhere around 1.5% around the world. It's much lower than that now. But because they couldn't take care of everybody in Italy, this was in northern Italy, in some places that death rate rose to 10%. So
Let's
when
talk about.
you're,
Ooh,
yeah,
no,
so,
go
but
ahead.
the moral of that story is if you don't have enough resources in healthcare to take care of people, you're gonna have increased deaths. Your death rates are gonna go up, and not just from COVID. If you're
Mhm.
having a heart attack and you come to the hospital and there's not enough ambulances to pick you up, you may die at home because the ambulance never got there because they're full taking people to the hospital. You may die in the emergency room waiting for a bed because there's not enough beds in the emergency room. Not
That
COVID.
has, that
Yeah,
has me
sorry.
thinking. No, that has me thinking. I've avoided going to the hospital. Because of the condition I have, I get infections, and
Hmm.
we'll talk about that in a little bit off air. But
Sure.
when we come back, I do want to you to discuss. Oh snap! Um, we ta- um we talked about social distancing, but I want to go a little bit more in detail. You know, based on what you know now, what are some of the recommendations when it comes to gathering, not gathering, everything in between? Whatever we can get in the last segment. This has been a really great show, and I know we could talk about this for hours, but we'll be right back after these announcements.
Thank you.
Okay, so we're still on Facebook. So, um, uh, the condition I have, I get infections often,
Hmm.
and due to lymphatic system, discrepant stuff. Anywho, but I've avoided going to the hospital because I know that they've been overwhelmed. So, what about people, say, like me or others that are prone to getting septic or just some other minor infections? What do we do? Like, that's a thing that concerns me because I know that if I don't get the treatment that I need in a timely manner, I can become septic. No one wants to be that. No one wants to get to that point because then your blood is filled with toxins, and you're on a slow decline. So it's scary to think people
Hmm.
are not getting the treatment they need.
Yeah. So I don't want to imply that that's happening here. It's not happening locally and throughout most of the United States. I know that the envelope's been pushed, but we really haven't had an increase in death rates due to lack of hospital resources
Okay.
in the United States like they did in Italy. But if you look at what's happened in Brazil, we have a decline in cases right now. Everyone should be pretty thankful about that. It is not the time to uh, decrease our vigilance. We should continue to be social distancing, hand hygiene, cough etiquette, wearing masks, and everyone who can should get vaccinated. Um, because what happened in Brazil is that they are experiencing a horrible surge due to a variant, and their numbers are way, way up after a really significant drop in numbers. And that's what may happen here. I'm very concerned.
Mhm.
So it turns out that the hospital during the uh, COVID-19 pandemic turned out to be one of the safest places to be in the United States. There was very, very little transmission to healthcare workers in hospitals and essentially to patients. The most common, we talked earlier about where it was most common to get infected early in the pandemic, and that was your own home.
Okay.
As the pandemic progressed and the number of people who were infected increased, it was these super spreader events that became the most common or most likely way to get infected. And I don't want to imply that these super spreader events are anything like, parties with hundreds of people. They aren't. They can be a gathering of 5 to 10 people that events that are that results in 30 or 40 people being infected, and then from that, hundreds of people being infected, and that is the main driver. So if you're at a restaurant, and um, and gosh, I miss restaurants so much.
I'm
I
sorry.
really haven't gone out since the
We're
beginning.
coming right back. I'm
Yeah,
sorry.
yeah,
Okay, welcome back to Community Conversations on KLK 102.5 FM. I'm going to let Dr. Abraham continue on. We've been having such a great conversation, and I want to make sure we get as much in it in the time that we have left. So go ahead, Doctor.
yeah. So, we were just saying how much I miss restaurants and going out. And I really haven't done that during the pandemic. But if you are 6 feet away from the next table, that restaurant is making it safe. If you're not, and your mask is off, and that restaurant is full, or if you're at a bar and that bar is full, um, those are super spreader events. And that is the way that COVID-19 is being spread throughout the United States right now. And that's not to say that gatherings for the Super Bowl or traveling for Christmas and having a big family gathering. Some of the real tragic super spreader events have been funerals. So um, any gathering of more than just a few people is a potential super spreader event. And that's why gatherings are really not recommended at all. We don't want people to gather together like that. And I know that's a really, really hard thing to swallow.
Yes.
I hate it. I'm a really social person, and it is difficult to struggle through this time. But uh, in order to stop the mutations, in order to stop a variant from occurring that causes a surge like there is in Brazil, we have to stop the virus from replicating, because it's when it replicates, it mutates. The
Well,
only the only way to stop it from replicating is to stop the transmission from person to person.
and then let me ask you this, and I know we have a short time in this segment, and this is another discussion because it involves the economy. But as a doctor, would you recommend that we just say all over the world to take a good 2 weeks, just 2 weeks, and just stay completely in your own space? Change out the filters in your home. I watched a segment on This Old House. They were talking about you can make your own filter, but you have to have the type of filter that traps the teeny tiny particles. So making these changes, staying like at home, like God, I know that's a hard pill to swallow, but is it something that could help?
I don't know the answer to that question. I'm not uh, some of the questions about the economy are best answered by economists, and there has been data and models published by economists uh, that do suggest what we should be doing. So I'm going to let them speak to that. Uh, from a transmission viewpoint, from a sort of epidemiologist, epidemiologist standpoint, we need to do something to stop the transmission from person to person in order to let the vaccines do their work without a mutant coming to pass that escapes from the vaccine, making all of that work for nothing, and we're back to ground zero, because that is what's happening in Brazil right now. So
Okay.
whatever we can do, and I certainly understand how difficult this time has been for everybody, for businesses, for people. It has been a very, very difficult time for those with mental illness and those without mental illness. This has been a
Mhm.
really, really stressful time. So anything you can do to make yourself more well is really, really important. Uh, you had mentioned before being hesitant about going to the hospital. Certainly, if you have an illness that needs to be taken care of, this is not the time to neglect that. People need to take care of their diabetes. They need to take care of their heart disease, their blood pressure, their lung disease. They need to get their cancer screenings, and children need to get their vaccinations. All of those things have really not been taken care of well during the pandemic. So that really needs to happen. And that's not necessarily not part, as healthcare workers, we don't bear, we do bear part of that responsibility. It is incumbent upon us to make sure that we take care of our patients, even though it's more difficult at this time. And things like telehealth, which I really recommend. I don't know why we didn't do that sooner. Uh, Drive-through clinics, things like that. Anything we can do to make things easier for patients to get their health care, we should do it. And not just in the pandemic. I hope we've learned a lot during this time about the things we do that makes it difficult for people to get health care, and why we shouldn't be doing those things.
All right. Well, Dr. Abraham, thank you so much for joining us. And I know, again, this conversation can expand on and on and on. And there's so many more questions that people may have. And real quick, are there any websites that you can recommend as the best start to get some answers?
Um, there's the John Hopkins website, the Mayo
Okay.
Clinic,
Okay.
and the Cleveland Clinic, as well as Harvard, have excellent sites that explain COVID very well. And I know NYIT, we've worked on some things for our students. Uh, uh, I believe the NYIT website also has a lot of information for the public. So I'll throw that plug in there too. Um,
Okay.
what I would say is uh, stay away from things like Facebook, Instagram, and stuff like that. There's a lot of armchair quarterbacks when it comes to not just COVID-19, just about
But
anything.
everything.
Yeah, and when you make recommendations or predictions about people's health, I think you have to remember that that can affect people um, in ways that you don't really intend. And
Okay.
people's health is important.
Okay. Well, Doctor, we thank you again. So, oh, shoot. So very much. And so I apologize, you all. We're going to have to cut the conversation here. It has been an hour, and If you have any more questions, please reach out to the school, NYIT, College of Osteopathic Medicine. Contact Dr. Abraham or any of the other physicians there, and they can get you on the path to get the information you need. So, again, thank you for joining us, and hopefully we can have you again to answer some more questions. Maybe take a different path, or because there's still so many questions and people. I don't know if you ever have all of the answers, but I know there's so many more questions that we probably really addressed today.
Yeah,
um,
thank you so much. I hope this was helpful. I think
yes, sir.
I'd be glad to do this anytime, and I won't be surprised if we do it in a week or two and things have completely changed.
All right, because definitely we didn't get as deep into vaccines because I've been hearing more and more people, not more and more, but some people are getting really ill from the vaccine and some are not having reactions. So that's a whole other ball
Get
game.
your
There's a
vaccine.
whole nother.
Get your vaccine. Get your vaccine. Yeah, I can't recommend it enough.
All right. Well, thank
Yeah.
you, doctor. And I hope you have a great day.
All right. Thank you so much. You too.
Bye bye.
Bye bye.